My name is Simone Frank. I'm an engagement and outreach coordinator with the North Carolina Translational and Clinical Sciences Institute, and I work within the Community and Stakeholder Engagement Program.
My name is Veronica Carlisle, and I'm the Senior Community Health Educator in the Office of Community Outreach and Engagement at UNC Lineberger Comprehensive Cancer Center.
And one thing that we have in common is that we each help manage our institute's community advisory boards. Community advisory boards, or CABs, are a common way of integrating diverse stakeholder voices and perspectives into research activities. And they can range from providing input on a single study to guiding the work of entire organizations, and can really help serve as a link between communities and researchers.
We're excited to share a bit more about our community advisory boards, the roles they play within our organizations, how we develop and work with our CABs, and reflect on key lessons learned throughout our CAB development journey. The UNC Lineberger Comprehensive Cancer Center is a cancer research and treatment center at the University of North Carolina at Chapel Hill. Serving patients at North Carolina Cancer Hospital, Lineberger is the only public comprehensive cancer center in the state of North Carolina. Within Lineberger is the Office of Community Outreach and Engagement, or as we call it, CO for short. And we meaningfully engage the community in Lineberger's research, clinical care, and programmatic efforts to better understand and serve the population's needs. To accomplish this, we manage Lineberger's Community Advisory Board. There are 12 members from across North Carolina who are leaders in the communities they represent. They bring a broad range of perspective and expertise that reflect the geographic, gender, racial, and ethnic diversity of the state, as well as across the cancer care continuum. They strive to synergize institutional and community efforts to engage diverse community stakeholders in addressing the cancer burden and reducing disparities. CAB member involvement thus far includes members participating on Lineberger's Equity Council, members serving as reviewers for Researcher Developmental Awards and the Community Pilot Programs. They've responded to researcher requests such as a review of educational material and recruitment of protocols. They've also written letters of support to partner with investigators in the research. They've assisted with program development such as researcher training in patient and community communication, and they've co-presented during lecture series and conferences. The views and opinions of our CAB members are integral to infusing community perspectives to help ensure that Lineberger's efforts are timely, relevant, and responsive.
So NCTracks is housed within the School of Medicine here at UNC, and we're funded by the National Institutes of Health. The reason we exist is to help support the research community here at UNC, as well as across the entire state. And one of our key focuses at Tracks is to help build authentic partnerships and connections between researchers, communities, patients, and healthcare providers. So we've started to take what we're calling an engaged science approach to our work. And this framework really recognizes that community engagement, inclusive approaches, and diverse recruitment are really essential pillars of advancing equity in research. And because so many health interventions, start with research, whether it's changes in medical care, community level programs, or health policy changes, advancing equity in research is a key component of achieving health equity. We're so excited that we recently developed an Equity in Research Community and Patient Advisory Board here at Tracks. So we'll be collaborating with our CPAB on efforts that aim to address structural, historical, and practical obstacles that prevent underrepresented communities from fully participating in health-related research. Our CPAB officially launched in October of 2021. We have 11 amazing members who are community members, patients, and advocates from across the entire state, kind of each bringing such varied and rich perspectives and backgrounds and experiences. And I'll also mention that the positioning of this CPAB is really unique in our Institute's history. We've had advisory boards in the past that have supported specific studies and projects, but this CPAB will really help guide our overarching programmatic activities and operations, and really help ensure that an equity lens is centered broadly within all of TRACS. So our goal is to ultimately help shape how research is done at UNC and really elevate the programs, guidelines, and processes around equitable and inclusive research. So when we first started out on our CPAB development journey, we were so lucky to be able to connect with UNC Lineberger's Community Outreach and Engagement Office. And we quickly learned that they had recently gone through a process just like this, and they had so much valuable information they could share with us to help guide our own process. So we really couldn't have embarked on this journey, I think, in the way that we did without developing this kind of informal mentor relationship with Lineberger.
I'm located in northeastern North Carolina in an area that is identified as an area of high disparities, Northampton, Halifax, and Warren counties. And we were invited to participate as a member on the CAB with Lineberger. And that was an invitation we were delighted to have, because we wanted to be a part of a network, a statewide network, so that we could understand how the priorities were being made in terms of delivery of services and care as it relates to breast cancer, and how we can help improve the overall outcomes in our community. But it's interesting because being a part of this allowed us to learn about academia and what goes on in that setting, and research as far as working with cancer and reaching some decisions, setting priorities, and working on programs to impact in that area. So being a part of the CAB gave us an opportunity to participate and create a shared vision and a plan that would be carried out, and we could participate in and be a part of it. So I would say it's a perfect model for helping bring together those with similar interests in an issue that we can all address and work together on. And I think it would give us all a sense of inclusion and not feel isolated being in our individual areas and just working in isolation, but knowing that what we're doing is contributing to the state of North Carolina and the outcomes and the data that we have affecting our families and decisions that are made, the projects that are developed, all of those things connected to the care, services, and outreach to improve our overall health outcomes and lower our rate of cancer deaths across the state. So we're working with the CAB, and we're doing well and looking forward to continuing the work. It's a great organization, a great model to use to help bring together people from across the state.
Hi there, my name is Prudencio Martinez. I'm a member of the NCTracks CAB, or Community Advisory Board. I came on board recently. I was invited to form part of this group, and it's all about research. It's all about the community. It's all about pushing changes in society for the good of the people. So I've had some experience in the past, in research. I would say plenty, especially qualitative research. Numbers and quantification of everything can be boring. I love the human element, and that's why this group, it's so interesting to me. And so I've had some experience dealing with communities, dealing with things that matter. And that's what I see in this group. After the first meeting that we had in January, I can definitely see that this is something that matters, because the community is important for all of us, and we want to make changes. So we have a diverse group. We have people from all walks of life, different generations, ages, ethnic groups, and I think this is wonderful, because diversity is in my vocabulary, and I really want to see that growing more and more, especially in North Carolina. So in that conversation, I can tell that there's a lot of passion, a lot of intention. Intention is really important, in everything you do. Purpose, and I think all these different perspectives is going to feed the initiative with a lot of good things. Not one thing it's absolute. I think everyone can bring something, and from there we are going to kind of knit, this amazing blanket of research. I don't know, I see things in a very weird way, and I see things in colors and knitting and everything. So everybody will bring something, and we will create something big. I was really happy to be in that conversation, comfortable from my house, having a really good coffee, and just discussing ideas with great people. And so that's my main reflection. I can go on and discussing all the details about the different structures, but that's not the purpose of this. I just wanted to say that I'm really happy to be in this group. Such a diversity, amazing multicultural perspectives, and above anything else, the intention and the purpose to create really good research in order to help the communities achieve change and positive futures. I think that's the best idea to say. And so thank you very much.
So the biggest takeaway from this experience for us is that you don't have to do this kind of work all on your own. You really don't need to reinvent the wheel when it comes to developing your own advisory board. And I would absolutely encourage people to be intentional about seeking out others who are doing similar work and who you can learn from. And I can say that we truly wouldn't have been able to develop our CPAB in the way that we did without mentorship from Veronica and from the Lineberger Community Outreach and Engagement team. And there were definitely a few specific parts of our process that were really heavily informed and guided by Lineberger's experience with their CAB development. The first was we learned how important it was to get on the same page as an internal staff team before moving forward with our CPAB development. And we learned from Lineberger that early in their process, they went through this really cool mind mapping exercise where they got together as a team and they really thought through what they wanted the purpose and the vision of their CAB to be. And we did a similar process with our track staff team. We had a staff retreat, and Veronica actually led us through a facilitated focused conversation where we decided that the focus of our CPAB would be on equity and research. So that was a really key moment for us in our process. We also learned a lot about different recruitment strategies, and we decided to implement a multi-stage recruitment process where we not only relied on suggestions and nominations from our staff and other colleagues, but we also went through a broader outreach process and reached out to networks across the state to share information about joining our CPAB. And that was really key in expanding our network and really recruiting a diverse set of members from across North Carolina. And finally, Lineberger's approach to having one-on-one conversations with potential CAB members really inspired us to do the same at Tracks. We were very intentional in our conversations about asking things like, what do you hope to get out of the CPAB? And what would you like to see the CPAB work on to make sure that we could really create an experience and space that could meet people's expectations and be mutually beneficial. It also led us to develop a multi-pronged training and onboarding approach to help meet people where they were in terms of their previous experience with research and familiarity with TRACS and UNC. So we actually created a repository of onboarding resources that people could review and reference if needed and at their own pace. And then we had a two-part orientation that was really focused on relationship building and team building, introducing folks to TRACS, and we did that all before really diving into our first meeting in January. So those were really, really important and key lessons learned from our collaboration with Lineberger.
Thanks, Simone. I appreciate my involvement in establishing your CBAP. In reflection, I find the collaboration both meaningful and rewarding. It was meaningful for me to pass along my experiences, and it was rewarding to have new lessons learned and to see your CPAP come to fruition. I think what proved to be important was providing more than just a list of steps and strategies to convene a CAB, but we also discussed why these steps and strategies were done. And it was during some of these discussions that you took these strategies and made them your own. It was this tailoring that provided me with ideas for enhancement of my CAB management. For instance, our interview process for new members is now a multi-step procedure. In terms of onboarding, we had a few resources that we could provide new members, but thanks to you, we now have an expanded library of resources. I also found your strategies for introducing your institution and preparing members to work together very helpful. Thinking about next steps and how we can continue our collaboration, there are several things we might consider. We both are developing our CAB evaluation plans, which help us determine if the CAB is making an impact in our institutions and communities. We both are developing CAB evaluation plans, which will help us determine if the CAB is making an impact in our institution as well as the communities. We can find out if CAB members feel like they're making an impact and can find benefit in participating as a CAB member. We might also think about collaborating on creating a CAB member transition plan or a CAB sustainability plan to make sure that our CABs become woven into the fabric of our institutions and play a key role in their operations for years to come. We can even think about creating a space to have periodic check-ins and even bring our CABs together on occasions. Our mentorship is a great model for others. If you're looking to establish a CAB, you don't have to do it alone.